Over there, send the word over there. We'll be over, we're coming over, and we won't come back till it's over there.
I had a little bird, and its name was Enza. I opened the window, and in flew Enza.
Author Sandra Updike states, during the last 2 weeks of October 1918, more than 9,000 people died in New York City from a single cause. During the same 2 weeks, about 7,500 people died in Philadelphia, and another 4,400 in Chicago. These Americans did not die in fires or floods or earthquakes, but in a different kind of calamity, the Great Influenza Pandemic of 1918. The United States' encounter with the influenza pandemic of 1918 and the exchange of the disease across the nation and in World War I camps led to explorations in the medical field that are still significant in public health today. The U.S. entered World War I in 1917, and in 1918, as the Great War was coming to a close, the world encountered a lethal strain of influenza that severely affected the nation and its war efforts.
Okay, so as you know, the Spanish flu was, which was one of the devastating pandemic in the history of pandemic, 1918 to 1990, killed about close to 700,000 Americans. It started with 3 deaths in Kansas City, and then it spread across America.
The amount of American victims of the pandemic was nearly 6 times greater than American casualties from fighting in World War I.
So, life expectancy has gone up every year since, 1700, except for 1 year, 1918. So it's, it was a huge worldwide public health event.
Author Jessica Rudolph writes, on the morning of March 11, 1918, a soldier went to the camp hospital with a fever, sore throat, and a headache. By noon, 100 more flu patients had arrived at the hospital. By the end of the week, there were 500. Physician Victor Vaughan warned the public,
if the epidemic continues its mathematical rate of acceleration, civilization could easily disappear from the face of the earth within a matter of a few more weeks.
Many victims of the pandemic were soldiers. Due to their close proximity to one another, the battlefields and training camps became breeding grounds for influenza. When the pandemic struck, 40% of the U.S. Navy and 26% of the Army were incapacitated by the pandemic, which some historians believe affected the end of the war.
During the Spanish flu, it was most of the transmission took place due to soldiers' migration, right? Okay, it was first World War I, right? And that's when that's the primary population that was affected for the first time, and then it spread from the soldiers to the rest of the population.
Poor sanitation, inadequate diets, and overcrowded, dirty conditions of battlefields allowed for the exchange of influenza on both sides of the war.
But what was different about the 1918 is it affected a lot of young people. We usually think about influenza affecting the very old and also, maybe babies, infants. But this affected healthy, young, including soldiers. And it was devastating.
works, but in the history of the modern world, it's probably the most significant public health event of all time.
As a first attempt at containing the pandemic, the national health system and state health departments explored ways to inform the public of the dangers of influenza, such as science and propaganda. Many people of color encountered the pandemic from places of economic disadvantage. This was also complicated to a greater extent by racial discrimination. Reports published by white public health workers frequently charged minority communities with being problematic populations, as well as misdirecting the blame for the desperate conditions to its victims. One of the methods that worked the best was social distancing. The public health system prohibited large gatherings in public places to avoid unnecessary exchanges of the virus. This technique has been used since medieval times. At the time, medicine was very unexplored. Typically, people consulted with apothecaries, called druggists, or created their own remedies. A 20th century sanitarian explained that the urban slums were hit the hardest by the pandemic due to the bad water, bad air, and bad habits that plague them. This tragedy changed the lives of Americans and also created motivation for many to research this pandemic. Author Nancy Bristow explains that while many people were enthusiastic about government funding of research, many were not. They felt that government funding would interfere with states' and individuals' rights and would lead to overtaxation. In 1933, influenza A, which is a strain that usually causes the influenza epidemics that we see today, was isolated. In 1940, influenza B was isolated, and lastly, influenza C was isolated in 1950. These explorations allowed for scientists to create an influenza vaccine for the first time in 1944. But due to the rapid mutations of the influenza virus, a new vaccine must be created every so often. Author Virginia Aronson analyzes the legacy of the pandemic on the public health system, saying, "Today, the Public Health Service is a more highly organized, much better funded, and far more effective agency than the public health system of 1918. With a yearly budget of over $20 billion and more than 55,000 professional employees providing vital health services in every state, the public health system has succeeded in its primary mission of improving the nation's health and safety." The influenza pandemic of 1918 had such a profound effect on the lives of the citizens that it was blamed as being the cause of severe depression, suicide attempts, and cases of insanity. This being said, many people, including the survivors, were eager to forget about the pandemic. Even though this epidemic was a monumental event and was instrumental in improving America's public health system, it was not until 60 years after the pandemic occurred that a full-length historical book was written on it, exploring the horrors of the pandemic. Nearly all of the notable authors of the time chose to leave the pandemic in the past and not explore it any further. In fact, the only well-known American poem that emerged from the pandemic was the rhyme that children used to chant as they skipped rope. It went as follows.
I had a little bird. Its name was Enza. I opened the window, and in flew Enza.